Hi, my name is Juliana and I am your nurse. Can I get your name and date of birth, please?
Hi, my name is Jane Doe. I was born 1/14/1962.
Okay, so your doctor wrote up some discharge papers for you today. Are you excited to go home?
Yes.
Okay, so I was just wondering if you have any questions for me before we begin.
Yes, will I be taking any new medications?
Yes, you will be taking Lasix and ciprofloxacin.
What is Lasix and ciprofloxacin?
Lasix is a diuretic, and this is going to help take off the water that has accumulated in your legs from your alcoholic hepatitis. And the ciprofloxacin, that is an anti-infective. It's like an antibiotic, so it is used because you tested positive for the E. coli bacteria. So you're going to be taking that until the prescription is done with. Just so that we can make sure that it gets all of the infection. And with the Lasix, I just wanted to make sure that you understood that you should the best time to take your Lasix is in the morning rather than at night, because if you take it at night, you're going to be up going to the bathroom, because since it's a diuretic, it'll make you pee a lot. So the best time to take it is in the morning.
Okay.
So since I answered all your questions, we're going to go through some basic teaching with your diagnosis. So
Okay.
you were diagnosed with alcoholic hepatitis.
Yes.
And this is an inflammation of your liver due to alcohol abuse. So when you were admitted, you told me that you drank 1 liter of vodka a day. So with this alcoholic hepatitis, you're going to have to stop drinking that much alcohol every day. Your prognosis is, well, you have damage to your liver, so we're going to just continue to follow up. It's really important that you continue making follow-up appointments with your primary care provider. That way we can monitor the disease process and how much damage you have and whether it's going to be short-term or long-term. I wanted to just go over some signs and symptoms that are important for you to report to your doctor if you experience. If you notice that your stomach is getting like larger in girth and you feel like you're retaining some fluid in your abdomen, that's important to notify your primary care physician of. If you experience a fever that's like really high and lasts for more than 24 hours, that's important to notify your provider of. Also, due to your liver damage, toxins can build up in your body, which will cause some changes in behavior. So if you find yourself or anybody in your family notices that your behavior is changing, that is really important to notify your provider of as well. Do you have any questions?
No.
Okay. So since we covered a lot of information in a short period of time, I just want to go over and make sure that you understand some of the stuff that I taught you. So can you tell me what your diagnosis is and what it means?
Alcoholic hepatitis. It's like inflammation of the liver due to me drinking 1 liter of alcohol a day. So.
Okay. Do you remember what the best time is to take your Lasix?
In the morning.
Okay. And do you remember why?
Because it's going to make you pee throughout the day.
Right. So there's just one other thing that I would like to go over with you. Obviously, we talked about your environment and trying to stay out of trying to partake in an alcohol-free environment and not, don't give yourself those opportunities where you can find yourself in a place where you would like to drink. A big thing also is exercise. If you can partake in about 10 minutes of exercise at least in 10-minute intervals every day of swimming or walking or anything, this can help decrease the inflammation in your body, which will also in turn decrease the inflammation in your liver. Mm-hmm. So this is a good way to kind of help to counteract some of the symptoms of your diagnosis. Any more questions?
No.
Okay. Thank you so much.
Yeah.